Hi, this is Communications Director Allison Bamberger coming to you today with Chief Medical Officer Gary Wilmoth with University Center Fire Department. And today we're going to kind of give you an update on where we are with the COVID-19 situation. So we talked a week ago. What's changed?
I think the next week or two you're going to start to see some more positive tests, right? So now the testing kits are now in the area. The hospitals and the providers have those tests. That's where you can access them. There should be a number that we will provide with. Mercy has a drive-up testing process that you don't even have to get out of your car. So, but you do need to book that in advance, right? You can't just drive up there. So you're going to call the number that's provided, and then they will set you up with how to test that. We have some of the numbers on how long this virus lasts in the air and on surfaces. Right now, CDC numbers have it as 3 hours in the air. So someone can leave a room and still the virus can still be around in that room. So that's one of the reasons for the social distancing, like we've been talking about. It's 4 hours on copper counters. It's 24 hours on any kind of cardboard, and 2 to 3 days on plastic or steel. So what all that really means for you is you need to disinfect and wipe down your surfaces just like you would normally do. There's nothing special you need. Either Lysol type wipes or regular bleach solution can clean all those surfaces.
That's great. We also know that you all have been very busy the last week. And we also know that as you all get calls, we've got kind of a special getup that people might see, and it might be a little bit alarming.
Right. So we're going to have firefighter birds going to come in and kind of show what we're wearing on calls now.
Great.
So anybody that calls 911 that presents with a fever, a persistent cough, traveled in the last 14 days, or flu-like symptoms, this is how we're coming in now. So there's two reasons for this. One, to protect our paramedics from the virus, and two, should the unfortunate issue where the firefighter happens to have it and doesn't know it, they're not going to give it to you. Okay. When we go to elderly facilities and nursing facilities, we'll be in this kind of PPE as well, personal protective gear.
So we've got a gown.
Got a gown. We have our N95 mask, our eye protection, and our gloves.
Great.
Then after the call, we obviously decontaminate the person, our person, the ambulance, and then we're back in service.
Great. Thank you so much. Appreciate it. Is there anything else that we want to communicate to the public? Obviously, continue to wash your hands.
Right.
Social distancing.
Right.
What else?
Which is 3 to 6 feet from each other for the most part. So the exposure criteria is, it varies kind of depending on which hospital you talk to, but in general, it's that 3 to 5 feet we want to keep away, and it's the droplets from the cough and the spray from the sneeze that they're really working to try and limit. If you find yourself presenting with a fever above 100.4 degrees, persistent cough, flu-like symptoms, or some other respiratory illness, if you call 911, you need to be prepared to answer a few questions about that. And then if it's possible, if your symptoms are mild, come meet us at the door. Open the door for us, and maybe we may even have the interaction outside. We're just trying to limit contact in confined spaces is what we're trying to do. If your symptoms are mild, you really don't need to be at a hospital ER. That's if you're having difficulty breathing, shortness of breath, chest pain, all those normal bad things, then you should definitely go to the hospital. But if you're just having those mild flu-like symptoms or the fever, the hospital probably isn't the best place for you right now because it spreads in that population as well, right? What you would want to do is call 314-615-2660. 314-615-2660. That's the public health hotline, and they will work on getting you tested or whatever they need there. They'll ask you the questions to see if you meet the criteria, and then see if you need to be tested.
Thank you so much, everybody. Stay safe, and feel free to contact us with any questions. Thank you.
Thank you.